Bismillahirrahmanirrahim. The topic of our discussion today is cholelithiasis. So cholelithiasis refers to formation of stones within the gallbladder. It is also known as gallstones. So gallstones are of two types. The first is cholesterol gallstones and the other is pigment stones. The cholesterol stones are those stones that contain greater than 50% cholesterol monohydrate crystals as part of their composition, whereas the pigment stones are composed of calcium salts with unconjugated bilirubin. The cholesterol stones are more common in the Western countries than the Asian countries, and they appear in the advancing age, mostly after 40 years of age. They are more common in the females than the males, the reason being dominance of estrogen. The estrogen upregulate HMG-CoA enzyme, which results in excessive secretion of cholesterol in bile. Moreover, obesity and metabolic syndromes also predispose to the formation of cholesterol stones, and rapid weight reduction also leads to formation of cholesterol stones. In contrast to the cholesterol stones, pigmented stones are more common in Asians than the Western countries, and they arise as a result of biliary infections such as E. coli and Ascariasis. Chronic hemolytic syndromes also increase the production of unconjugated bilirubin, which results in the formation of pigment stones, and moreover certain gastrointestinal diseases such as Crohn's disease also increases the risk of pigment stones. The mechanism of formation of stones is different for cholesterol and pigment stones. So cholesterol dissolves in the bile and lecithin to get excreted from the body. When there is excessive cholesterol in the blood, the cholesterol secreted into the bile rises above the solubility threshold and results in supersaturation of cholesterol. This excessive cholesterol in the bile becomes insoluble and it starts to accumulate within the gallbladder. The insoluble cholesterol forms mononuclear crystals, which are known as cholesterol monohydrate crystals. These cholesterol monohydrate crystals come together to form cholesterol stones. There are certain conditions which are associated with the increased formation of cholesterol stones. The first of all, it is increased cholesterol in blood. Since the excessive cholesterol is excreted in bile, the supersaturation results in formation of cholesterol monohydrate crystals, which tend to form cholesterol stones. The next factor is hypomotility of the gallbladder due to decreased peristalsis, which favors the accumulation of cholesterol within gallbladder. The third factor is hypersecretion of mucus in the gallbladder. This excessive mucus also traps the cholesterol, hence increasing the amount of cholesterol in the gallbladder. This excessive accumulation of cholesterol in the gallbladder increases the chances of crystals formation within the gallbladder. Pigmented stones are formed as a result of either the bacterial infection, such as in E. coli, or they are formed due to chronic hemolytic anemias, which result in increased unconjugated bilirubin. Moreover, certain GIT disorders, such as Crohn's disease, also increase the risk of formation of pigment stones. So in case of E. coli infection, a specific enzyme is released known as beta-glucuronidase. This enzyme hydrolyzes the conjugated bilirubin and converts it into unconjugated bilirubin. This unconjugated bilirubin accumulates in the gallbladder. Likewise, the hemolytic anemias also increase the concentration of unconjugated bilirubin. So increased unconjugated bilirubin forms complex with the calcium salts, resulting in formation of pigmented stones. The cholesterol stones can be either pure or they can be impure. Pure cholesterol stones are very rare, and the impurity is due to presence of calcium carbonate, calcium phosphate, and bilirubin salts with calcium. The pure cholesterol stones appear pale yellow in color, as you can see here. This is a gallbladder that is filled with small, pale yellow colored cholesterol stones. Moreover, the impure cholesterol stones appear gray-white to gray-black, depends upon the concentration of unconjugated bilirubin. The cholesterol stones are almost round to oval in shape and they have faceted or rounded hard surface. As you can see here, these stones have faceted surface, which is due to the formation of multiple excessive stones in the gallbladder. Pure cholesterol stones are radiolucent, which means the radio waves can pass through these stones, hence they are not visible on X-rays. The impure cholesterol stones are radiopaque, which means they are visible on X-ray. This visibility is due to more than 20% calcium carbonate in the composition. The pigmented stones can be either black or they can be brown in color. The black pigmented stones are formed in the sterile bladder, which means there is absence of infection. Moreover, the size of black stones is less than 1.5 cm and they are rarely larger than this size. They are formed as a result of calcium carbonate, calcium phosphate and calcium stearate. And since there is excessive calcium carbonate component, these stones are radiopaque, which means they are visible on X-ray. In contrast to black stones, the brown colored pigmented stones are formed in the infected gallbladder, such as E. coli, and these stones are formed of calcium salts with unconjugated bilirubin. Since there is a less quantity or absence of calcium carbonate, these brown pigmented stones are radiolucent, which means they are not visible on the X-ray. Almost 70 to 80% of patients with cholelithiasis remain asymptomatic. Alternatively, the symptoms of cholelithiasis include biliary colic. Biliary colic means a waxing and waning pain in the right hypochondrium. Sometimes it is also present in epigastrium. Biliary colic is occurring as a result of gallbladder contractions against the stones lodged in the gallbladder or cystic ducts. There might also be nausea and vomiting and loss of appetite. In case of infection, there might be a history of fever and chills as well. Liver function tests are mostly normal, but in case of an obstructed stone, there is increased level of ALP and bilirubin as well. Ultrasound of the abdomen reveals the presence of stones within the gallbladder. The treatment of gallstones is surgical removal of gallbladder, also known as cholecystectomy. Untreated gallstones can also result in complications such as cholecystitis. Cholecystitis means infection of gallbladder. In certain cases, the stone is lodged in the neck or in the cystic duct, which results in the accumulation of bile inside the gallbladder. This also results in increased inflammation and increased chances of infection. Severe infection can turn into empyema. Empyema means when the gallbladder is filled with purulent fluid. The infection can also spread from gallbladder into the blood, resulting in disseminated infection known as sepsis. In certain cases, the wall of gallbladder can also get perforated, which constitutes an acute surgical emergency. Moreover, a fistula can also be formed, and in many cases, these gallstones slide down into the bile duct, hence blocking it at the ampulla of water. This results in inefficient drainage of pancreatic enzymes in the second part of the duodenum. Hence, the enzymes start to accumulate inside the pancreas, which can lead to acute pancreatitis. Often, these gallstones can slide through the ampulla of water into the intestine, causing intestinal obstruction, which is known as gallstone ileus. This is a rare complication of gallstones. There is also an increased risk of gallbladder carcinoma due to the formation of gallstones. So this brings us to the end of discussion about cholelithiasis. If you have any questions, do let us know in the comment section. Thank you.